Our panel members this afternoon are Loi Wong from Hong Kong Labour Rights Monitor, Ivan Law, an NHS nurse and UNISON member, Joe Donnelly, National Health Officer for Health and Safety at UNISON. I'll ask each of them to speak in turn and then we'll go to the Q&A session. We're also lucky to have with us two regional organisers who are migrant worker leads for organising members in their regions. Dario Lopez is an area organiser from the London region, and Joe Lambert, a local organiser in the South East region. They will answer questions related to their regions. But if no one is able to answer your question, we will take a note of your details, or indeed you can email us at i.relations@unison.co.uk. That will be put in the chat and someone will get back to you after the event. So before we finally begin, I'd like to give you a little introduction to UNISON and why we are holding this webinar. UNISON is the UK's largest union, serving more than 1.3 million subscription fee paying members who work to provide public services in the public and private sectors. We're really proud that 70% of our members are women, as is our General Secretary. We help our members to get better wages, terms and conditions at work, and we represent them when they're faced with challenges at work with their employer. This covers all aspects of work, including health and safety, which is the focus of our webinar tonight. UNISON has a really proud history also of solidarity with workers and their trade unions worldwide. And we work to defend public services and fight against austerity around the world. For the past few years, we've worked in solidarity with the ex-Hong Kong trade union leaders that are now living in the UK. And increasingly, we're working together to reach out to you, the British nationals overseas and other Hong Kongers in the UK, to help you to understand your rights at work in the UK and to invite you to join us as members of UNISON, and indeed to get active and have a voice. This is the first of 3 webinars we plan to run in the coming months, along with targeted activities planned for those Hong Kongers living in the West Midlands, London, and the southeast of the UK, where the majority of Hong Kongers are living. Our second webinar will focus on women public service workers' rights in the UK, and we'll be advertising that to you in our follow-up email with the link to this webinar. So finally, that's enough from me. Let's get started and hear from our first guest, Loi Wong.
So,
You're done?
yeah, I'm done. Thank you.
Thank you. Thank you very, very much, Loi. That's great. So we're now going to hear from Ivan Law, who is a nurse in the NHS in London, and he's a UNISON member. And we hope he's going to get active in UNISON if he's not already, but he's active tonight, and he's going to be speaking about his health and safety experiences at work. So over to you, Ivan. Hi.
Hi. So I'm actually has signed up to be our bench health and safety rep recently.
Excellent.
I'm waiting for training, actually. Yeah.
Fantastic.
咁多位參與者，大家好啦。咁就I'm just gonna speak with Cantonese, yeah.
Yes.
Yeah. 咁其實我嚟呢度分享咧，我似介紹下自己先。咁我係Ivan啦。咁我而家係喺呢個Royal National Orthopaedic Trust 嗰度 Hospital Trust 嗰度做嘅，咁就係 NHS 咁度做咯。咁我 mainly 就係做一個infection prevention and control nurse，咁即係中文就係感染控制組咁。 咁就其實平時咧，我咧就即係都有好多遇到一啲關於健康與安全嘅問題，不過係主要關於傳染病嘅，即係譬如可能最近我唔知大家有冇聽過，即係有中文係叫百日咳啊，就喺度流行，有啲唔同嘅倫敦都有啲地方係有好多 case 咁樣，咁有啲同事中咗之後咧，咁就即係會問我哋要點樣去，即係可能做一啲嘅隔離，點樣保護翻其他嘅同事免受佢一啲嘅感染咁樣啦。咁其實我最近都聽到有一個個案係關於即係工傷或者係職業安全嘅問題嘅，就係但係我就即係當時我並唔係喺NHS 度工作啦，就有個醫生嘅同事咧，咁就因為即係工作就中咗 Covid 啦，咁然之後就即係有一啲COVID-19 嘅後遺症咁樣啦。咁即係包括可能係即係有啲朋友咧，其實曾經係亦都識位同事嘅朋友咧，係即係中完之後個心長期都有啲心臟長期都有啲問題，要長期服藥控制翻個心率咁樣嘅。咁於是咧，咁其實我哋其中一個幾得意嘅位咧，就係即係醫院嘅一啲可能防護嘅 policy 咧，係好同即係同事嘅工作息息相關嘅，甚至呢一個醫生嘅 case 咧，甚至係一個即係上到去有機會有一個 dispute 同埋一個 court 嘅 case 咧，咁我哋就需要，咁我哋感染控制組最近咧就需要去揾翻晒喺當時候推出過嘅一啲關於 COVID-19 嘅一啲嘅感染嘅控制嘅措施，咁有冇我哋有冇盡頭先阿來講啊，僱主有啲責任去保護大家，即係有一啲提供一個安全嘅工作環境。咁我哋有冇喺因應當時嘅即係大流行嘅情況底下，有冇做一啲適當嘅措施去保護翻同事咧？咁所以咧就即係我都而家要參與去 dig out 翻，要去揾翻呢啲咁樣嘅資料去，即係去睇下能唔能夠去即係揾翻當時究竟醫院係做咗啲咩？咁所以其實喺我日常嘅工作入面都會接觸到一啲關於職業安全嘅問題啦，同埋係尤其是係喺醫院工作嘅同事，我哋都會即係感染控制都要去配合成個醫院去推出一啲關於疫苗注射嘅問題啦。之前有包括麻疹流行嘅問題咁樣咯。咁呢個就係我個人嘅經驗，我都會好睇得到，即係公司嘅一啲嘅政策或者係防護點樣保護同事嘅制定，點樣影響到成間醫院嘅運作同埋同事嘅職業安全咁樣。嚇，呢個大概就係我而家工作上嘅一啲嘅分享，可能比較沉悶一啲。如果對一啲唔係對傳染病好有興趣嘅朋友，就係咁。
Mute myself. Hi, thank you very much, Ivan. That's great. So, we're now going to turn to Joe Donnelly. So Joe Donnelly is the National Officer for Health and Safety at UNISON's office, and he's therefore our expert on health and safety. So we're going to go over to you, Joe. I'm just going to share my screen.
Thank you, Gemma. Whilst you're bringing up the screen, I'll introduce myself. I think that needs to go to full screen there.
Yeah.
Perfect. Okay, hi everyone, welcome. My name's Joe Donnelly. As Gemma said, I am the lead for health and safety in Unison. I'm going to give you a bit of a presentation. I'm not going to hopefully keep within the 20-minute marker. I'll keep it under that, so you won't have to hear me droning on. But the presentation will be about health and safety in public services. There, of course, isn't enough time to cover everything, but we will cover some key aspects of health and safety and how Unison interacts with these issues of health and safety in the workplace. I'll, of course, take questions following the presentation as well. Next slide, please. One more, that's perfect, thank you. So straight into it. What is the employer's responsibility relating to health and safety? So as you can see, there's a whole host of legislation in which the employer is duty bound to uphold. Now, what's really important about this legislation, especially the top one, the Health and Safety at Work Act 1974, that the employer is duty bound to ensure, and this is the important term, so far as reasonably practicable, the health and safety and welfare at work of their employees. So we'll talk a little bit about what is reasonably practicable in a minute, but that is set out in the Health and Safety at Work Act. So it means that the duty holder, the employer, must assess the degree of risk against the sacrifice involved in introducing a control measure to eliminate or control the risk. Now, I now know that sounds a bit jargony. So ultimately what it's saying here is the employer is duty bound to try and get rid of all the risks. Now they have to assess whether the thing that they're going to do is actually going to remove the risk or mitigate it. And that's what's really important about what the employer should be doing to protect you at work. In addition to all of this legislation, there's even more. So there is legislation under the Section 44 of the Employment Rights Act, where you have the right to leave the workplace and refuse to return until any imminent danger has passed, so far as to protect yourself from danger and others. Now, implementing that's really important. This is where the health and safety rep role, your branch and your union kicks in. It's how we interpret this legislation to protect you. So as you've heard, you can get involved as a health and safety rep, and you will hear a little bit more about that in a minute. So next slide, please. So these are the 5 steps to a risk assessment. So this is basically one of the key tasks or the key factors that an employer has to consider when upholding their duty. The duties we just spoke about, what the employer is responsible to do, these are the steps that they should be taking in a risk assessment. So step 1, identify the hazards. Step 2, identify the people and who might be harmed and how. Step 3, evaluate the risk and decide on precautions. Step 4, record the significant findings. Step 5, review and update as necessary. So the risk assessments are part of the management process. The process is called a management process and are included in the Management and Health and Safety at Work regulations. A risk assessment is the process of identifying what hazards currently exist and cause harm in the workplace. So its purpose is to ensure that hazards are eliminated or risks are minimized by the correct application of relevant standards to prevent workplace accidents. So to contextualize this, to give some examples, what might a risk assessment include? Things that a risk assessment might include are hazards such as electrical safety, fire safety, manual handling, hazardous substances, stress, violence, infectious diseases such as COVID-19, but it also can include tasks. So if you are cleaning with chemical substances, there should be a risk assessment for that. If there is maintenance work being done or you're dealing with the public, risk assessments need to be done for that. And other factors such as organizational factors, staffing policies, systems of work, hours, shift patterns, if you work alone or lone working, all of these are things that should be risk assessed. Next slide, please. So what a risk assessment must be is suitable and sufficient. Now, I won't go into detail on all those bullet points here, but as you can see, there are things that should be done. Ultimately, by law, every employer must conduct risk assessments on the work their employers do. If the company or organization employs more than 5 employees, then the results should be recorded with details of any groups of employees particularly at risk, such as older workers, younger workers, pregnant workers, or disabled employees. Next slide, please. So this, and next, just press the next button, please. This is called the hierarchy of control, okay? And I'm just going to walk you through this. This is what an employer should be following when it's looking at risk and risk assessment. So I'm just going to say the top one there you have here is elimination. So can we, and the employer will look at this and say, right, what can we do to deal with this risk? We should be looking firstly at eliminating it. Can we get rid of this risk? And if not, it's worked down the pyramid there. So it goes to substitution, to engineering controls, to administrative controls, to PPE. Now, as you can see at the top, it demonstrates that elimination, quite obviously, is most effective. We get rid of the risk completely. But when that is not reasonably practicable, as we saw earlier, the employer must work down through substitution, engineering controls, all the way through to personal protective equipment, as PPE. Sometimes we find employers jumping straight to PPE or jumping straight to administrative controls. But what we need to see, and what we're failing to see on a wider scale, is eliminating these risks as far as reasonably practicable. So, returning to the 5 steps of the risk assessment briefly, we identify the hazards, we decide who may be harmed and how, we evaluate the risks using the general principles and prevention of the hierarchy of control approach. So this is what we use to evaluate the risks and then look at and decide whether the existing precautions or the things that we're doing are adequate, or do we need to do more, or does the employer need to do more? So we then move on, and finally, obviously, to recording your findings and reviewing the risk assessment. So this is really important part of health and safety at work. Next slide, please. So, health and safety representatives. As you heard from Ivan, he's already signed up and waiting for training. I'm going to give you a little bit of detail about what a health and safety representative does. So, a health and safety rep, you're appointed by UNISON, not your employer. It's really important. You'll get training, would support you, and you would be supported by your branch, and you'd be supported by your regional staff as well. Ideally, in a workplace, there should be at least one safety rep. Once a safety rep is appointed, the employer must be notified in writing of that appointment. Now, again, you will be supported by your branch secretary, and other health and safety reps in your workplace to do this. If you are new, again, we have the support and expertise in our wider branches and in our regions to help you as well. So as a safety rep, you have the right to represent your members in consultation with health and safety inspectors and the employer on any matters related to their health, safety, or welfare. As a health and safety representative, and this is really important, you cannot be held responsible for the conditions in the workplace. That responsibility, as we saw in the legislation, for health and safety in the workplace rests firmly with the employer. Next slide, please. So the legislation that supports you, and it's a really strong bit of legislation for representatives. So health and safety representatives have this specific regulation that applies to them. It's called the Safety Representatives and Safety Committee Regulations 1977. So you'll see a list of some of the rights and entitlements that you have. So that's from carrying out inspections, examining the causes of the accidents, receiving information from HSE and local authorities, investigating complaints, time off with pay to perform your functions, time off with pay for appropriate training, and reasonable facilities to perform those functions. What we know in UNISON is that trade union health and safety reps can only function effectively with time off and facilities. To perform the role effectively, we work and we support you as reps through our branch structures to ensure that as a minimum, you have sufficient time off for work to do the job, time off for UNISON or TUC approved training, and adequate facilities and assistance. Next slide, please. So your rights under the SRSC, so that's the Safety Representatives, Safety Representative and Safety Committee regulations. Here's just a list of some of those that are actually set out in legislation and the regulations that apply. As you can see, there's a lot here. I'll give a minute just to review those. Okay, next slide, please. Okay, colleagues, can I pause here for a second? They've got a technical issue this side. Could I just hand back to Gemma for 30 seconds?
Of course you can. We'll just take a very brief pause. Maybe there's a battery that's starting to run out unexpectedly or something. So if you can just bear with us for a few minutes, I'm sure that Joe will be back online in a moment. In the meantime, I would ask you that if you have any questions at all, please go to your screen, the bottom of your screen, and I think it's on the right-hand side, if you click more, or if it's not already in front of you at the bottom, you'll be able to see the Q&A icon. And if you don't want to ask your question by speaking, then you can write your question. So we hope that we're going to get lots of questions from you. And we always say that no question is a stupid question. It's always much better to ask than to be too worried to actually speak out. And we often find that the people that do speak out are actually asking the questions that everybody else wished that they could ask.
Thank you, Gemma. I am back and you were correct. I had a little bit of a battery issue there. It seemed to be unplugged. So can everyone hear me okay? Good. Okay, so there was a question that was posed to me before this presentation about what is the Health and Safety Executive. So just to touch on this briefly, the Health and Safety Executive is a British public body responsible for encouragement, regulation and enforcement of workplace health, safety and welfare. Additionally, it does some research has a research role into occupational risks in the United Kingdom. But simply, the HSE is responsible for enforcing the Health and Safety at Work Act. So they may be inspecting workplaces and investigating incidences. They make recommendations of legislation, they provide information and guidance, and more they are conducting research. UNISON, we meet regularly. I personally meet regularly with the HSE to discuss matters of health and safety. And we also engage with the appropriate government departments on matters of health and safety. So this is the body that enforces health and safety standards at work and the investigations. Next slide, please. So we talked a bit about the hierarchy of control. We've talked about hazards. We've talked about risks. And one major hazard for our members in public services is violence at work. Now, this can be from anyone when you're at work, whether that be a member of the public, whether that be a colleague, but a lot of it is what we call third-party violence, especially in health and social care, where we see a lot of violence towards our members and workers widely. So the definition from the Health and Safety Executive about what violence is any incident which an employee is abused, threatened, or assaulted in circumstances relating to their work. So importantly, any definition must include incidents leading to death, major injury, or requiring medical assistance, and minor injury. But it's equally important to include threats and verbal abuse, even if no physical injury occurs. And that's really important. Often people think that that's not part of it, but it really is. And that has other major factors to other people's psychological health as well, which we will touch on in a little bit. But this is, as I said, a major occupational hazard for many members in Unison. Next slide, please. So what does the law say on this issue of violence at work? As you can see here, next, keep going to the end, there is number 8, perfect. And there's lots of legislation that is in effect to protect. However, the implementation of risk assessments, the hierarchy of control that we spoke about, and the processes that employers implement are just as important about some of these blunt tools such as legislation. Really important, but it comes down to how is the employer responding and acting and supporting workers. So, as we know, employers have a duty to protect the health and safety of their employees, but it does apply to this factor. And employers must report all incidents involving physical violence on employees that result in death, major injury, or absence from work for more than 7 days. Unison, we've campaigned successfully for one of these legislations, which is the recent Assault on Emergency Workers Offences Act 2018, which provides greater protection for those working in the police, emergency services, and the NHS. Next slide, please. So what are we doing campaign-wise? So what we've done to ensure that employers are upholding standards that we see should be implemented to keep our members safe is our End Violence at Work Charter. Now, we've had some real successes here where we've had local authorities sign up, we have had private sector employers sign up, and more employers are signing up to our charter. So this is something that can be used as a tool. So as you've heard from Ivan, once you sign up to become a member, you then sign up to be a health and safety rep. We'll put you on training, and then we will provide you with resources and support, such as this charter, to organise, but also represent workers when there is a health and safety incident. Next slide, please. Another hazard at work, biological hazards, a big factor for our members, especially in the healthcare. So biological hazards are organic substances that pose a threat to health of people and other living organisms. So most biohazards often come from bacteria, viruses, parasites, and molds or fungi. Biological agents, biotoxins, blood and blood products, environmental specimens are all biological hazards. Additionally, chemical hazards are also major risks at work as well. Now, I won't go into those details here, but as I spoke about earlier, for instance, if you are using cleaning products, there are chemical hazards associated with that, for instance. Next slide, please. So, psychosocial risk, this might be a new term to some of you, but ultimately, what it means is how are you psychologically affected? How are you socially affected? How are you economically and environmentally affected? So there's no really globally accepted definition for what a psychosocial risk is, but psychosocial factors are shorthand for, as I said, psychological, economic, and social influences on workers, which can have an impact rather on both physical and mental health and well-being. Psychosocial risks arise from poor work design, organization, or management, as well as poor social context of work. And they may result in negative psychological, physical, and social outcomes, such as work-related stress, burnout, and depression, and musculoskeletal disorders. As you can see on this image in front of you, you can see that there's physical factors at work and an arrow pointing to musculoskeletal disorders. So if there's a physical factor at work that you're being affected by, standing up on your feet all day in a shift without a break, lifting heavy boxes, you could develop musculoskeletal disorders. But also, if you're suffering those same physical factors at work, you can have an impact on psychological factors at work. So if you're standing on your feet all day, you can become stressed and anxious, and that can in turn lead to symptoms of stress. And in turn, those stress symptoms can lead to musculoskeletal disorders. So there is a dynamic interplay here about these risks that people are facing. And these risks about being stressed, even being overly tired, working alone, being fearful from violence or attacks or pressure. All of these must be dealt with as the same as other risk factors, such as manual handling or driving. They have to be dealt with through the same risk assessment process. And as we spoke about, the hierarchy of control process, an employer must look to eliminate stress in the first instance and then work down. So next slide, please. Now, I won't go into too much detail on this issue because it is really huge, but building safety is a big factor for us in UNISON. The environments in which you work and the buildings in which you work must be safe. We know that in many public buildings, there are dangerous materials such as asbestos and RAC. Now, if a person is exposed to these, dangerous materials, they can be deadly. So it is really important that as a UNISON health and safety rep, for instance, or being part of your UNISON branch, we work to ensure employers review their asbestos and RAC responsibilities and all other building safety responsibilities. And if necessary, ensure that they take steps to manage and control these risks. Now, as I said, these deadly substances need to be disturbed, or they need to be damaged, or need to be crumbling or in a process of decay. Now, there's lots of guidance on this on our UNISON website and lots of guidance on the Health and Safety Executive website if you want to know any more about this issue. But it is a big factor for us in UNISON. Next slide, please. So, artificial intelligence. I'm sure many of you will have heard about artificial intelligence, but I'm going to speak a little bit about how it applies to OSH, so occupational safety and health issues. So artificial intelligence or other algorithmic systems are transforming work, management and models of business across all sectors. So examples of this could be that there are these algorithms or other data analytics to ensure there's a oversight of workers, say, time, assessment and evaluation of that worker's output. There are benefits, but there are certainly some negative sides to how we're approaching AI within the workplace, or at least some concerns that we have. But there are potential benefits. So there could be safety monitoring, there can be health surveillance, for instance, but negatives could be that there's a bias, discrimination, a lack of transparency. And a big issue will be that people not knowing the intentions of the algorithmic management systems that are being put in place. How can people trust them? So those bridges need to be, we need to bridge that gap rather. So there is work going on at a trade union Congress level, and UNISON is looking into how we can ensure members are supported from any risks relating to artificial intelligence. But it is a evolving issue and something that we are keeping up with. Next slide, please. So, occupational health standards. An employer's intention to help workers can drive positive health outcomes. But when one outcome of, say, all the risks that we've looked at and others are not meaningfully addressed and assessed, it can lead to ill health. So when it leads to ill health, what can cause it, what can lead to ill health is because people are struggling to access the flexibility and adjustments they need to stay well in work. In addition to that, we have very few or inadequate occupational health services available. So it will be a no surprise to many of you on the call that we desperately need a fully funded NHS alongside a clear baseline for quality occupational health provision. Statutory sick pay needs to be sufficient if people are to fully recover. This might be supported by effective health and safety regulatory oversight. So there's lots that needs to be done, and it is something that in UNISON and from myself and the Health and Safety Unit, we are lobbying and engaging policymakers to see changes in this area, because it is one thing to stop people going off sick and keeping people well in work, but it is also important that when people do fall down and people do get ill, that there are sufficient and fair processes to support them back to work. Next slide, please. So what resources do we have available for you? Some of the information I have talked to you about today are in some of our guidance here. Now, I will put the website link for all of these guides that you can download for free on a PDF and look at your leisure. And there's things on that legislation that we spoke about at the start, hazardous substances, there's work-related stress guidance, and there's also guidance on tackling violence at work. Next slide, please. So getting involved. So I know that the link has been put in the chat on how to become a health and safety rep. So you can follow that link. We, as you've heard, provide, just to go back, there we go. We do provide training, and there's a whole host of trainings that are available. In addition to that, once you are a health and safety rep, you have the opportunity to become engaged in your regional health and safety forums and committees. Now, I won't spend too much time talking about this, but ultimately, the Regional Health and Safety Committee is a subcommittee of your regional council. Its the main job is to take the strategic view of health and safety in the region, and it sends one delegate to the National Health and Safety Committee and provides a link between the regions and national. Also, in addition, you have regional officials. So they are your regional health and safety leads, which support you in your health and on issues of health and safety, and provide support to your branches. So what is this national committee I've spoken about? Next slide, please. So the National Health and Safety Committee. Ultimately, it's a subcommittee of the National Executive Council and deals with UNISON policy on health and safety matters between annual conferences of the union. Now, members of the regional committees, as we spoke about, nominate someone to sit on these on this committee, along with service groups and NEC members. The objectives are to represent the health and safety interests of all UNISON members, ensure that the work of the committee fits within UNISON priorities and objectives. And as you can see, its composition is what I've just spoken about: the National Executive Council, Service Group Executive, and regional regional committee members. So its responsibilities and accountability is to submit reports on the health and safety activities, contribute to the work of the committee. Now, I'm conscious there's a lot of jargon and there's a lot of abbreviations there, but ultimately what I'm saying to you is, if you want to get involved, sign up to UNISON, look at becoming a health and safety rep, get engaged with your branch, and then look at the other democratic structures that we have in which you can get involved in. Next slide, please. So ultimately, what are we calling for as UNISON? Some of these key issues on health and safety. Now, there's a whole host of things we do, but I can only speak to the health and safety. The government must review health and safety legislation, considering carefully some of those hazards we spoke about, including violence at work, artificial intelligence, building safety, biohazards, psychosocial risks, just to name a few. We need to see a set of mandatory criteria for employers concerning the reporting of incidents at work. And we are not seeing enough incidents being reported in the right way, especially of incidents of violence. And as we know, verbal abuse fits within that framework of violence. We're looking for effective occupational health standards that we spoke about. And colleagues, many of you on the call will be fully aware that we need to see safe staffing levels and fully funded public services. Next slide, please. And that brings us to the end of my presentation. You can follow us on Twitter at unison_HS and contact via our email address there. Thank you for listening to me, and I hope I didn't go on too long, but I'm going to hand back now and open for questions. Gemma, I can't hear you.
Sorry. Thank you so much, Joe. That was really, really informative. I certainly learned some things there as well. So questions. Now I have to quickly try to find which questions came up. I'm going actually to the chat, and then I'll look at the the Q&A area as well. So in the chat, if you haven't already looked, we've got some links that have already been put there, including a QR code, as was mentioned. And also, if you're not yet a member of UNISON and you would like to consider joining, please do. And there's also something there for you, both a QR code and also our website. So there's a question here from Jolo. Is it reasonable for the employers to ask the employee to pay for a safety training? Thanks. Dario, if you also spotlight yourself, because if there are any regional questions, we'd love for you to also answer. So, yeah, that's the first question, Joe.
Yeah, no problem. Short answer is no. If it's mandatory, then you should not be expected to pay for that training effectively. However, if you are in a situation where you are requiring health and safety training and you would like it for your personal and professional development, then there can be a discussion about that. But if it's mandatory, that health and safety training should be provided by the employer.
Okay, so if it's something you're requesting because you'd like it, then you have to probably pay. But if the employer has to provide it, then they should pay for it themselves.
That's right. I would go further to say that if the employer is encouraging you to do it in any way, or you would like to do it for your professional development, it would be good practice for the employer to do it. Because if you are trained, especially as a health and safety rep, that is going to be better for the organization. But if outside of your contract, you are being asked to pay for health and safety training, which should unnecessarily needs to be provided to you, then you should not be paying for that directly.
Great. And if you're a UNISON member and you and your employer is trying to make you pay for something they shouldn't be making you pay for, then you can go, if your employer has got UNISON recognized, then you can go to your UNISON rep and ask them. And if not, you can call one of your regional, well, the regional office. That's right, Joe and Dario, right?
That's correct.
Okay. So, the next question. Tai Xing has put, okay, here we go. We've got it in Cantonese and then English. A colleague in the company injured his back while lifting heavy objects. He was put on work-related injury leave, but the compensation was only about £90 per week. Is this the lowest limit in the UK? And then there's a second question that goes with it. Also, how can I provide a work-related injury certificate? Do I have to go to the hospital or to the GP?
Yeah, good questions. Thank you. Yeah, so there is a baseline in terms of the injury benefit. However, what we encourage is employers to support workers beyond the minimum standards. So if they are injured at work, it is the employer's duty to support them and support them back to work. So it's not just it shouldn't just be a criteria of what's the lowest common denominator, or is the lowest amount we can give an employee, such as statutory sick pay or accessing state support, such as injury benefit. There should be supportive process, as I spoke about in the presentation. Occupational health standards require employers, government to act and support workers when they are either injured or ill from work. So it's a broader question, and as a health and safety rep, it would be, and it is ideal to be negotiating and bargaining for better terms and conditions in relation to these issues. And the second question was in relation to, could I remind it, please?
So the second question is also, how can I provide a work-related injury certificate? Do I have to go to the hospital or the GP?
Yeah, I mean, I'm assuming this is if you are off sick with work relating to an injury, and how you can actually prove that to your employer. It's about how you demonstrate that with your fit note, as we call it. So you would need to be able to go to see a medical professional, provide a fit note back to your employer to say, here's a medical professional's opinion, I am not able to work. Now, there has been some movement recently on who can sign off this fit note if you say have an injury at work or you're sick from work. Ultimately, it is ideal to get it from your GP, but you can get that from other medical health professionals. But at the moment, they must be a health professional. I would go to your GP in the first instance, and if there needs to be somewhere where they direct you to, you can. But there is also what we call occupational health therapists that your employer might have in their staff team or in their departments, and that they may want to assess your injury and your support needs as well. So there will be an element of duality to the assessment, but it starts with the fit note, and that should be your GP in the first instance, but that can include other health professionals. What I'll do is I will put the link for the fit note and who can sign that from the government website in the chat after this.
Great, thank you. And we'll make sure that we include that in the follow-up email as well. Okay, so we have a question from Daphne Ho. Hi, I'm now working in a children's residential home. Since my home hasn't started on a schedule, I am assigned to do shadow shifts without overnight shift in another home. In my contract, it listed that normal hours are 160 hours and 10 sleep-in duties per month. The arrangements in place as to your days and hours of work upon commencement of this appointment are not contractual and may be varied by the company upon reasonable notice to you at any time. The head office said they are not going to pay the 10 sleep allowance since my home is not operating yet. I am confused if they are breaking the contract or not, that they didn't provide the overnight shifts and they're not paying for it. Cheers. So, Joe Donnelly, is there anything you want to say about shift work and health and safety? And then maybe I'll see if Dario or Joe Lambert want to come in on any of those.
Yeah, I think I'd firstly say that this falls a little outside of a health and safety question in relation to contracts and support for sleeping shifts. My advice for you on this one would be to join UNISON and get support in relation to that. However, for health and safety, just looking at this from a purely health and safety perspective, without looking at the terms of your contract from the lens of employment law, that the employer must deal with, as I spoke about in the presentation, shift patterns in the same way it would deal with other risk factors and hazards. So if you are, for instance, in a environment where you're public facing, and it could be that you suffer violent attacks as a result, that must be risk assessed. If your employer has created a system of shift work overnight, which is detrimental to your health or physical or psychological factors, and that detriment is has a negative effect on you or puts you at risk, they must deal with it in the same way as any other risk. So that is one aspect in which the employers tend to fail to look at when it comes down to contractual law or arrangements for work. But again, I would be hesitant to advise on anything relating specifically to this and contract employment law.
Thank you. Would either of our regional organisers like to come in?
I'm happy to very quickly say, yes, I think join UNISON, or if you're not in the public sector, another relevant union. It will depend a lot on the wording in the contract specifically. It looks a bit like they've put some terms in there that have some typical hours and things like that, which would make me suspicious that they might be able to get away with it. But that doesn't mean that you can't negotiate with the support of your union colleagues. So yes, my advice would be join the union and have someone, a colleague, or if you are already in the union, the rep, look with you through the contract properly to make sure they are obeying it. And there may be other issues, even if they are adhering to the contract, such as minimum wage law, if they are making you work extra hours. But yeah, that looks like a relatively complicated matter. and the devil is in the details, as we say.
Great, thank you. Dario, anything else to add?
Just to add that if you are already a UNISON member and you have concerns about contracts, the best way to receive some advice will be to contact your local branch. So every member, anyone who becomes a member of UNISON and works in the public sector or in a private company that is providing services to a public sector body, they are allocated to branches, and your branch will allocate a representative, or they will give you advice by phone. So what I've done is I've put on the chat a link that will take you to, depending where you work and depending which is your employer, will take you to your branch. I hope that helps. Thanks.
That's great. Thank you very much, Dario. So we have another question. I'm also aware that I'm asking questions from the chat room rather than the Q&A room. We will get to the Q&A room for those that did the right thing and put it in there. If I work as a self-employed delivery driver with an online shop, is there any safety obligation from the online shop? So this is not an area that UNISON would normally deal with, I don't think, because that's not in the public services, unless I'm mistaken and someone can correct me. But anybody got any advice for Queenie Lung?
I think just to say from a health and safety point of view, the devil will be in the details. So I would want to take a look at this in more depth. Ultimately, if you're self-employed, you have less rights than you would if you had a worker status or an employee status. But again, I'd be reluctant to provide advice on specific incidences or specific situations, given that there must be an agreement between a member and the union before providing that advice, and that is done through the online sign-up form.
Okay, great. Thank you very much. Right, let's get to, I think that was everything in there. I should do what I should have started with in the first. We have one question in the chat room. By the way, you can also put your hand up and ask the question directly yourself, either in some anonymous way or with your video camera on if you would like. And this is from an anonymous participant. Hello, I would like to ask, what is the maximum period for providing special arrangement and assessment for new mothers or a new mother if she doesn't provide a medical certificate?
Could you repeat the question, please?
Yeah. Hello, I would like to ask, what is the maximum period for providing special arrangements and assessments for a new mother if she doesn't provide a medical certificate?
It may be the phrasing of the question, but I'll answer it in this way, is that if you are an expectant mother, it is why it's important to provide a medical certificate to prove it if the employer is asking for it. But ultimately, it should be reasonable enough for you to say, I am an expectant mother and that I need those special arrangements in place. I don't know if there is a maximum period. I would say that it needs to be immediate. So if the employer isn't doing it, contact your branch and ensure that they do put in the safety processes and support processes in place for you for new and expectant mothers. There shouldn't be a time lag for this. The employer must act immediately. But I'm not sure on the not providing the medical certificate angle here.
And what if you're already a mother and you haven't provided, a medical certificate? I mean, it depends on how the question was
Ultimately
written.
here, if you've told your employer you are, they should be acting straight away.
Yeah. Dario or Joe, anything else to add? No? Okay. That's it. I can't see any hands up anywhere unless anyone can see any that I can't see. Because I haven't got the right screen on. Let me see. Don't want to miss anybody. No, I think that we didn't have any hands up. So that's it for now. We don't leave us yet though, because, so thank you very much, Joe Donnelly, and thanks
Welcome.
to Joe Lambert and to Dario. That was really, really informative, and I'm glad we had such a great selection of questions. So Joe Lambert now is going to tell us a little bit more about, we've already put it in the chat, but about how you can join Unison and what the QR codes are and other things like that, including some, hopefully, some leaflets that will be of interest to you.
Yes, thank you, Gemma. Hello, friends and comrades. I will speak very briefly. I will speak very briefly. Firstly, to say that I'm a Unison staff member in the Southeast. I'm also on the Migrant Workers Network as one of the leads. It is a new group in Unison that is getting very active. We have over 1,000 migrant workers in the network now, and it is growing quickly. If you are a member of Unison, make sure you join the network. I will show you a leaflet in a second. There will be information coming through the network, as well as similar webinars, as well as we will organising opportunities. Next, I will just quickly share my screen, hopefully. 2 seconds, I will share that screen. That is, we have a couple of new leaflets which will be sent out to you after this webinar. One on the Migrant Workers Network, recently translated into Cantonese, and also see if it is sharing. And we have another leaflet, what it is to be in a trade union, which is there. Do not worry about looking at it. These will be shared with you afterwards, but it is an example of work we are doing in the Migrant Workers Network to translate materials so they will be available for people. The final thing I would like to do is I will share with you these are, it is important to join a trade union, as you have heard from Ivan, from Loy, Gemma, from Joe. We are stronger together. You have the support of your union colleagues, and you can be trained to be a health and safety representative. You can get legal support. You can get support through education and through many other ways. So on the left, you can see, if you're not yet a member, you can go to that website or scan that QR code to join. On the right, if you're already a member, please do get involved. We are only as strong as we all stand up together as. If we all become health and safety representatives, then we will be able to negotiate with strength against the employers, and we will be a stronger union. If you follow that link on the right, there is a very, very short 1 or 2 minute survey, and I will make sure that somebody from your region is in touch with you. You are not making any promises, but it will give you some more information, and you can ask any questions about what it means to get involved and stand up with and for your colleagues. I think that is everything from me. You're muted, Gemma, sorry.
Sorry, thanks very much, Joe. There's one other question, which is from Chai Ching. Is it that all jobs in the UK have their own union?
Oh, I'm very happy to answer that. No, not all jobs have their own union. There are some unions that are specific to professions, such as the National Union of Teachers, the NEU. But there are UNISON represents all people who work in the public sector, but that is not just state companies. That is also jobs which are public facing and work for the public, like care homes and universities and institutions like that. There are other very large unions that also represent wide numbers of members. If you go to try and join UNISON, you will most likely be able to join. Most people can join. And if you cannot, it will direct you. You can find other unions that will represent you. There are a lot of different unions, and a few of them are profession specific, but many of them cover lots of different professions and jobs.
That's great.
UNISON.
Thanks very much, Joe. And actually, whilst UNISON doesn't represent teachers, for example, there is a specific union or a couple for teachers. We do represent teaching assistants, and that will be our third webinar that we'll be holding either later in the year or sometime in the new year. And it's the same, we don't represent doctors, but we represent almost all other workers who are in the NHS and health services. So, right, okay, we'll take one last question, if that's okay, everybody, from Taijing as well. My employer asked me to take vacation leave instead when I am asking for sick leave. Is this legal? So Joe Donnelly, I'm going to try and spotlight you. Dario's had to leave us, but Joe, if you could answer that, that would be great.
Could you repeat the question for me? Is it in the main chat?
My employer asked me to take vacation leave. Yes, it's in the main chat. Instead, when I'm asking for sick leave, is that legal?
No, the employer should not be asking you to take vacation leave when you are sick. If you are sick, and you need to be signed off and supported. Vacation is for vacation, put simply.
Brilliant. Thank you very much. Okay, I think we are most likely at the very end of our session now. I'd like to thank all of our brilliant panelists for today. Loi Wong for doing the challenging role. Well, you were going to do the translating, but we'll get to that later. And indeed, it was great to hear you all speak in Cantonese. To Ivan Law, Joe Donnelly, Joe Lambert, as well as to Dario Lopez. Thank you very much for taking precious time out of your evening tonight. And a very big thank you to our audience tonight. We really hope to see some of you getting active in UNISON. You will receive all the information in an email. And apart from that, we wish you a really, really good night. And thanks again for turning up.